piece of pizza on the way out.
Down here?
Yeah.
It's down here that way.
That's where, yeah, I think they're gonna go up in the hallway.
On the, you know, if we're gonna leave it.
There you go.
Did you guys make that? How are you doing?
Good.
I know. Hi guys. Hi. Oh my guys. Oh my god. Oh wow. Hi.
Good, how are you?
I'm good. How are you?
Good to see you.
Oh my boys.
Sandy.
Hi.
How you doing?
Good. Hi honey. Wow, overwhelmed here.
Thank you for your dedication and compassion while guiding us through the dark abyss of cancer and helping us heal back to the light at the end of the tunnel. Thank you.
This is our last support group meeting for this group, and they've been planning this since the first time we got together. So today's the end, and this is how they wanted to celebrate with you.
Oh, thanks guys.
Listen, we just want to say thank you. I think it takes some special people to do what you do, and it's greatly appreciated. The smiles that everybody wears. I don't think you realize how much that helps and how much it's appreciated.
Thank you so much for the kind words.
Yeah.
For me, it scared the daylights out of me. Even though I was told pretty much right from the beginning the prognosis was pretty good, still really scared me.
And I think it goes without saying, I'm honored and we're honored to have helped you with this.
Absolutely. We touch a lot of lives. And
I think what most important too, for anybody just starting into this, is listen to what the doctors are telling you. If they tell you you're going to need a feeding tube, then I certainly didn't want to put a feeding tube in, but I'm very glad that I did. It's when it's necessary, it's real easy to just unclip it and pour a can. It's a little difficult, like Luigi said, you kind of plan your day around every 2.5 hours you have to pour a can, so where am I going to be in 2.5 hours? You have to be home. Couldn't sit in the middle of Walmart's parking lot doing something like that. So, you use the syringe all the time to put a can in?
Oh yeah.
Because I didn't do that.
And I quit drinking, and then I realized after about 3 months later, I could send it down the tube.
Yeah.
So I went out and bought a bottle of Bloody Mary mix, and I would sit there and make Bloody Marys and send them down the tube. It felt better.
What I was going to say, for me with the feeding tube, I never was not able to swallow. So it's kind of different than Kevin's situation. I got to the point where I wouldn't eat foods, but I still drank water that way, and I still took pills that way, solid pills that way. So I think in that respect I'm a pretty fortunate individual.
It became a convenience. You didn't, because the taste of food.
That's right.
Is horrible.
Yeah.
That's
You avoid that part of, you know, not having to taste your food.
I mean, I have days I don't feel good at all, you know. I feel like checking in at the hospital sometimes. Like, you feel so, like, dizziness, you don't breathe like you used to, you know. You get short breathing in the morning, your throat is always cough.
Here, I had a major issue with my swallowing. I lost all the ability to swallow food. Liquids would go down the wrong way. It would go into my lungs. It was something that I had to monitor day in, day out, all day long. Swallowing, just basic swallowing through the course of the day. Sometimes you get scared. You find yourself getting into a panic because you're trying to swallow and you can't. Can be frightening. I've gone through several months of throat therapy, relearning how to swallow.
I've worked in oncology for 10 years, and I think that this treatment for head and neck cancer is probably the most difficult to endure. You are miracles, and I'm very blessed to have known you all.
I thought my life was going to end there. That's what I thought,
And I went to the ENT today, and the doctor said everything was fine with my throat, so that made me feel a little better.
Yeah, I had to go through it because Dr. Birnbaugh told me one thing: you have to go through it. It's up to you. The time I did it, if you want to do these, these treatments, I had to do it. Either way, or you have to do it, or either 2 years down the road you won't be around.
I think I went through this whole situation reasonably easy. Did have problems with the dry mouth. I know exactly what Joe was talking about with that, trying to sleep. But I think all in all, it was pretty easy for me. But the chemo really didn't bother me all that bad. The radiation, I think, was affected me more. Throat was really pretty raw and bled for, I don't know, probably 5 weeks, 6 weeks, something like that. And that was the toughest part of it for me. The chemo really didn't affect me that much at all.
The chemo, I guess, affected me a little bit more. I did go through a period of time where I was sick all the time, but I just kind of I dealt with it, and I tried to push myself through it. And that's, I thought I had no other choice but to do that, so I did.
The main thing getting through it all is having the family support, friends, to help guide you through it, and definitely do what the doctor tells you to do. They put the plan in place, and it's up to you to follow through.
You got to be strong. That's the first thing you have to do. You have to be strong to go through this. You can't give up on it. You got to keep fighting on it. If you don't fight, it's not going to help you.
If you don't do it, you're not going to be around. You stick to your guns and just basically you're in the fight for your life, and it's how you value your life. If you value your life, you're going to do everything that you can to get through it. It's an ongoing process. Things, pop up here and there that you don't expect, and that's part of it. A lot of it is not knowing what's going to happen, what's the next day is going to bring, but you wake up and you take it on, head on, and hopefully you come out on the right side of life.
It came to a point that I just didn't want to be around. I was so sick. I ended up coming back to the hospital twice. I was so sick. I couldn't walk. I couldn't do anything. I had to be in a wheelchair. I was so weak. It was really bad. You have to be strong. If you're not strong, it's a tough road ahead.
How has it changed you?
It's changed me in a lot of ways. I'm not the person I was mentally. My attitude towards people and life itself have changed. Not as quick to judge people as I used to be. Physically, I'm not. I had a very physical job, and I can't do anything for any length of time without paying for it for 2 days later. My body aches. I can barely get out of the chair the following day if I go out and do yard work for 3 hours or so. I know the next morning when I go to get up that it's very tough to move. It's kind of evolving as you get up. You get up and you're hunched over, and by the time you get across the room, you're finally standing up straight.
Like Jose's having trouble with his ears. I have my ears. Every once in a while they'll hiss, and then they'll pop and pop and pop, and then all of a sudden they stop and it goes away. But then all of a sudden it comes back again. But that's just something I'm working on.
Pump?
Oh, I had incredible amounts of mucus generated. And I sat next to a pump, and I would have to insert the pump to remove the mucus buildup, and I would probably produce a gallon to a gallon and a half a day.
Wow.
And so when I would try to go to sleep, it was that I knew that was forming, and what amount it took to wake me up was what made me get up and go to the pump and sit there and pump it out, and then I could try to go back to sleep. And I told Dr. Birnbaum that after a number of events like this, one morning I thought, what's the point? And so he said, well, if you'd feel better talking to someone about that kind of emotional predicament, that there were people here. And I did in fact visit with I don't know if she's a psychiatrist or a psychologist, but anyway, I ended up laughing with her and felt much better about it. So it was like, this is part of it, and you go and you do what you need to do.
I started treatment in early September and with chemo, and then finished radiation the end of January. There were complications. I had a blood clot, which was very bad and very severe, and I was in the hospital for a while. The biggest thing for me was taste and swallowing. I was afraid that I would never have my taste back. I couldn't even tolerate food. Perhaps the worst part of my experience was the nausea. I had very, very serious nausea during the whole process. It was always just barely to the point of vomiting. Right at that level, always. And for me, that was a horrible, horrible experience. There was a lot of medication I was taking, and that helped. But that was tough. That was really tough. I needed a lot of liquid, but I just couldn't get anything down. Couldn't eat, couldn't drink. So I had to have lots of IV infusions constantly. I was told I wouldn't lose my hair. And my hair started coming out like a dog shedding. So I decided to have a little party at my house. I got some friends together, and people just shaved my hair off. And it was sort of humorous and a lighthearted thing. Yeah. Thinking back on it, yes, there were a lot of problems, which I just took care of as they came along. But now, at this point, years later, it's just it's a minor thing that I don't really think about. I just feel very, very lucky to have been as fortunate as I am to have come through as well. It's been over 3 years now, and my life is back as if nothing had ever happened.
The biggest problem I had was just being tired and just having to remove yourself sometimes because you just couldn't stay awake.
Everybody in the cancer center has been great to me, and it worked. I just, you got to stay positive. You got to keep your mind positive. You can't be second guessing yourself. You can't not try and do something that you'll say to yourself, well, I can't do this. Well, let me tell you something. You think positive and you can. Because I'm sure, I'm proof of it, because I'm still going, and I survived. It's tough. It's not easy. It's tough.